All right, I think we'll go ahead and get started. Sarah, I'm sorry if your kids pinch you. All right, good morning, everyone. Thank you for joining us. Welcome to the March CHPRMS Coffee and Communications event. My name is Carly Gabriel, and I serve on the CHPRMS Board of Directors, and I lead the Membership and Education Committee. So to get things started this morning, first, we want to invite you to become a CHPRMS member. There are a lot of benefits. First of all, we have events like this, Coffee and Communications, and we also have events called Lunch and Learns that are free to members specifically. And of course, you get access to our member database and networking opportunities, and you get a discounted conference registration. And please don't forget to follow us on social media so that you can keep up with everything that we're doing. And that brings us to our conference. This is a really big one for us this year. We're celebrating 50 years of CHPRMS, which is really amazing. It's going to be a golden affair for us since it's our golden anniversary. We've set the date. It's going to be October 18th through 20th in Asheville, North Carolina. It's actually going to be at a new location in Asheville this year. It's going to be at the Renaissance Asheville Hotel in the downtown area, which is wonderful because it's going to be within walking distance to all the lovely restaurants and things to do in the Asheville area. So stay tuned for more information on that regarding calls for speakers and Wally Award submissions, as well as sponsorship opportunities. So that brings us to today's topic. We're going to talk about producing news for the news. So what if you could advance your brand by having more control over how local news covers your organization? You can. Newsrooms are shrinking, but their hunger for legitimate, timely health news remains strong. Now, why, you may be asking, would your local TV news stations use your content for free? Because it's exactly what they need, and they don't have the time or the people to do it themselves. And just before we introduce our speakers for today, I kind of want to set the media news landscape scene for you. I used to be a TV news reporter, so I have some firsthand experience with it. There are fewer and fewer resources in the news industry. There have been lots of cuts over the past several decades, and journalists have fewer and fewer resources, but they're asked to do more with even less. So this image on this slide of the photographer and the reporter, that's actually not even the case in a lot of markets these days, especially smaller markets. The reporter is being asked to do everything. They call them one-person bands. They're being asked to do video editing, as well as writing and all the other classic reporter responsibilities. And some are even being asked to do live shots by themselves. So they're being asked a lot of. Now, there are also unrealistic deadlines that they have to deal with from their producers, managers, editors, and the audience members themselves. And it's a constant grind and competition to be first. Now, all of this, plus everything that they've been through over the past couple of years, has just led to burnout. They're tired, and they really do need our help. So that brings us to our speakers today. We've got Andy Lyons and Robert Briggs. Andy Lyons, they're both with Rupert St. Francis Healthcare in Charleston, South Carolina. Andy Lyons is a veteran journalist and seasoned communications director. Robert Briggs is a former producer turned public relations innovator. Robert, Andy, thank you so much for joining us this morning. I'm going to hand things over to you.
Thank you so much, Carly. That was such a great opening. That was such a great segue. Let me know, are you getting my notes page or are you getting the actual presentation?
You can go ahead and share the presentation, and then I think we'll be just fine. Oh, we're getting the notes page.
All right, so let me swap. Having some technical difficulty. Okay, still the notes page?
Yeah, try one more time.
How about now?
Looks great.
Terrific. Thanks for, you know, we're about to talk about something that we use technology for. And just to start this Friday off, Carly knows this, but when I wanted to sign in like 25 minutes earlier, Roper St. Francis Healthcare wouldn't allow me access to speak to y'all this morning. So we're always battling technology, but this is about using technology and using our cameras to help the TV news. And before Rob and I get into this presentation, I want to say that it's not a brag fest. Like what we're doing here, it's so simple. You may already be doing it yourself. And it's I don't want anything to come off as a look what we got TV to do to advance our brand. I mean, since the pandemic, since that first day of the pandemic, TV has just been such an incredible partner to Roper St. Francis Healthcare. I mean, they did such a tremendous job in dispelling myths, in getting facts out, in calming people, in helping us talk about COVID, talk about complicated topics, allow our physicians to put things in layman's terms. So I really see this as a partnership, not so much like, a spike the ball in the end zone. I'm so happy for all these media placements. It's really like, how can we get the word out? And they've been so great helping us with that. So we'll move on and I'm going to go over some objectives. And so what we want to do in about 15 to 20 minutes is tell you how we want to help them, because as Carly so eloquently pointed out, they need content, right? And we can help ourselves because we can position our leaders, we can position our own team, we call them teammates, our own employees and leaders as experts, right? The voice of reason in our communities. We can make it relevant. We've got to make it relevant. It's got to be content that they would want to use, not just kind of dog and pony show things. It's got to be relevant content that's newsy, that's factual, that would perk their interest, that their viewers want anyway. And we got to make it easy, right? And we're going to show you how to make a press release with a few sound bites, with some B-roll, and send it to them in a way that they got to use it and they want to use it. And if they don't use it, you're still going to use it. So who we are, so Roper St. Francis Healthcare. Carly already identified Rob and I, and we also have DeEtte Casey, who's also active with CHPRMS. She came from the Post and Courier. She's a print journalist, covered education at the Post and Courier, and Josh Benzer, who also came from ABC News 4, and so did Rob. So I think that journalists are great PR people. I mean, this is no secret, right? We know how to tell stories. We know how to talk to producers and to reporters, and we know how to get them the content that they need. So real quick here, Roper St. Francis Healthcare, non-for-profit, mission-based, faith-based healthcare system in the Low Country, largest healthcare system for adults in the Low Country for adults. 6 ERs, 4 hospitals, 6,000 employees. That's kind of the proverbial who we are slides. So my kind of pitch about why does it matter? Why does TV still matter? Because they really, really do. And this is our case, and I'll be quick about it. They're still watching, right? So we know since 2020 that local TV viewership is on the rise. It's trusted, it's great. And so it's still such a great avenue to position your brand, to position your hospitals and your physicians as leaders. Carly said this, right? Newsrooms are shrinking, but their news holes are not. They need content, simply said. And if not you, somebody else is going to do this. It's free, right? It doesn't cost hardly anything. We're going to go over in fact, I'm not even going to show clips as much today because I want to be quick. I want Rob to show you the equipment and go through how we get this done. Oh, also, our physicians, our leaders, they love it. You know, they love, it's like PR for PR, right? They love to show these links. They share it on their social media. They're ambassadors of the brand. They feel great. Everybody gets a shot. Everybody who's good at it gets a shot. It's great internal kind of motivation. Okay, so 3 key tips. So Rob, we always use 3 video clips.
Yes.
Why 3?
So 3, you only have a certain amount of time that the news is going to show you something. They're always looking for like that one hit. And it's usually like 20 to 30 seconds. So we give them 3 options, which is just perfect. It's like the lead in, why it's important, and our message. And then we also have the B-roll, which is also important because they can use that B-roll over and over and over. When they're talking about hospital events, they might show your stuff rather than something they have like in archives. Why not it be your brand that they're showing people doing stuff?
Why is it important that we give them a little bit of B-roll? A little bit of like, you know, footage,
Yeah.
outside buildings, maybe a nurse working.
Yeah, it makes things easier for them. It also makes the interview go quicker, in my opinion. And they want to do something later with you. They already have all the footage. They're like, oh, I got all their stuff. And we can use this, like I said, over and over and over again. We're talking about Mount Pleasant Hospital, one of our 4 hospitals. They already have all the stuff. Maybe they're talking about one of our express carriers, which we have about 6 or 7 in the area. They have everything. So it just makes it easier for everybody.
Keep the press releases really tight, don't we?
Yeah, we keep them pretty short. And it's kind of like Ron Burgundy. Like they see the press release, they literally read it verbatim. They're like, oh, Roper St. Francis is hosting a cancer screening event. Da da da. And then they'll hop right into your clip. You only get like 1 minute during these segments. So the message is pushed through your press release very quick and easy. And then they have one of our 3 sound bites that they use.
What do you do if TV doesn't use the press release and the 3 video clips?
Yeah, absolutely. I'm sure like everyone else here, we have social media content. We have Facebook, you have Instagram, you even have LinkedIn. We just put those 3 clips together, super easy, put our B-roll on top of it, and it's automatically your content.
Okay, that's great. I'm going to step aside now, and Rob's going to talk about, I'm going to kind of, you don't see me, but I'm going to interview Rob because I want him to show the equipment and do kind of a show and tell portion. Why is it so important that you come extremely prepared?
I think especially when you're working with doctors, their time is short. It's so hard to like knock down, get like 30 minutes of their time. So if you come there and you're not prepared, they're going to know it, they're not going to like it, and they probably won't want to do it again. And this is supposed to be an opportunity where we can kind of break them into working in news, doing interviews and feeling comfortable and knowing that it's a simple process and we can knock it out in 15 to 20 minutes. So if you don't have your stuff, you make them wait around, you forget your SD card, which is one of the things that's very, very important to always have. I carry mine in an Altoids thing. It works for me. It's loud, it's noisy. I know if I'm walking into something, I know I have them. So always good to bring those. But yeah, it's so important to be ready to go for them because their time is short. It's important, but this is also important to get the word out, and we want to take advantage of that time.
What kind of camera do you use to film our videos?
Yes. So I'll start from the very bottom. This could be your camera. We carry it every single day. News reporters use it. Your iPhone can be used. You can put a lavalier mic on here for $30, and you get a little stand from Five Below probably, and you can hook it up and you'll be set to go. I saw lots of news reporters using this during the pandemic. Not only is people short, they're short on equipment. So this could be your first tool. I think everyone's kind of familiar with a DSLR camera, which a lot of people use just for stills and stuff. But if you look on the side of the camera, it has a mic. So you can plug your mic into here, you have your headphones, and you can go from there. The one I use in particularly, this is called a C100. That's a Canon brand. It's really easy because it works with your DSLR. You just take your lenses. You can interchange them. And this is just for video. And it's super simple. It's super easy. It's super user friendly. This is like the Apple of cameras, you know. It's very simple. You don't have to go through all the gadgets and what's this and what's that. You can literally put in an SD card and you're good to go. You have your mic set up. Don't really have to do much with that. And if you're really, really worried and want to get into technical stuff, you go on YouTube, honestly. They have reporters coming in right out of college that never held a camera in their life, and they're expected to do all these things. This is an easier version.
What's the most important item besides the camera itself that you want to bring with you?
You need a stand. You need to have it on something. I use this tripod. It's about maybe $250, $300 for this tripod. But the thing about all this equipment, it's all durable. It's you're putting in, you know, maybe for everything C100, you have absolutely nothing. You need microphones. It might be maybe $5,000–6,000, but you're going to have that equipment for 5 to 10 years. I haven't had any issues with it. As long as you're taking care of your stuff, you're okay. But yes, you need a stand, because if you have, this goes back to you not looking prepared. If you have just like a little camera and you stacking on a couple of books, they're going like, what is this Mickey Mouse show? Like, what's going on? We need to be ready, and it makes you look professional, and it's needed.
How much would an external mic cost?
Mics can be very cheap or very expensive, like most things. The one I have, it's hard to pronounce, Sennheiser. This is about 8 years old. I got it. I think we got this for about $200. You can get another one. I don't have one with me, but it's called like a Rode mic. You can find them online for as cheap as $70. And it's totally worth, like most things, you might fall somewhere in the middle in terms of price. You can either spend $400 or $50. Usually like that middle ground is the best place you can find yourself.
So say you're in a primary care office and you get in a few minutes before the physician shows up to talk about flu season. What are you going to do? What are you going to consider?
Yeah, you need to consider where you're filming this stuff. You need to consider how it's going to look on the news. If it looks bad on your screen, it's going to look even worse on a 50-inch television for someone at home. So consider your lighting. I mean, we haven't gone into the lighting, lights and stuff. Some people might not have them, but you need to be in a quiet room. You need to have nice overhead lighting. You want everything to look the same. That's always my goals. And just make sure you're in the right environment, because if there's noise going on and you get back to the office and you didn't hear that when you were reporting, there's nothing much you can do. We're not trying to waste the doctor's time, come back again, say, oh, sorry, like there was a crackle or there was a patient talking about one of their, something that they're in the doctor's office for. So make sure you're in a quiet area, make sure you have good lighting, and make sure you're prepared to make them look good.
How do you edit your 3 video clips?
So I edit everything on Premiere, which is Adobe Creative Cloud. The Creative Cloud, if you haven't used it, it gives you everything in terms of video stuff, photo stuff. You can get stock footage. You can do sound. It's so extensive. It's always upgrading, and it's pretty user friendly. I was basically self-taught, and it's really, once you start getting into it, it's not hard. And if you're really needing clips, Adobe does a good job of posting stuff to YouTube or things online, and you can learn from there. But it's pretty simple. And obviously, I'm a little more seasoned, so I can put together clips in 45 minutes tops. That's me looking at the sound, changing the color. If you want to just keep it simple, you can knock it out like 30 minutes tops. But it's a very simple program, and there's ways that you can learn to improve yourself if you want, but it's very easy.
But you don't give a whole lot of content, 50 seconds.
That's all you get. We talked about the time that you're going to be online. So on TV. So the difference, I would say, the biggest thing is when we give the content, it's usually a little shorter. And that's to be expected. The reporters put time in to do their story, so it's going to be like 2 minutes. When you do it, this is like your health segment that's on every single news station every single day. That's your spot you're trying to film. So you have like 50 seconds. So you want to get your message across with those 3 sound bites and your press release, and then you're good to go. And now you can use all those 1-minute clips, very easy to watch. You don't want like a 4-minute video on your Facebook page because no one's going to watch it. Make it nice and simple, make it 1 minute, and then you're good to go.
And you save it to Dropbox, and that's never failed, right?
Dropbox has been the easiest way for us. I literally just put all the clips in, and then we'll just create a link and send it out. And when you see one of these press releases, you'll see them highlighted in blue. So you have like the clips right there highlighted in blue, and you'll see the B-roll below that.
Okay. So this is the times then when we film this. It's like when we have to get the word out. And we're like y'all, we're having like cancer screenings, and you get this last minute service line director email, phone call. I don't have any signups. And if we do a physician talking about colon cancer screenings and there's free screenings, TV will run a little video of the interview of the doctor. They'll have the information. They'll then have some text that says, sign up. It works. It just worked. We just did it a week ago. 2 out of the 3 local stations ran it. The Post and Courier. Usually this doesn't work with print, but print needed a story anyway, and they asked us for a patient. We gave them a patient, and then they ended up doing a pretty big story with a bunch of photos.
Yeah.
We haven't used this so much, but like if you had bad news and you needed to control the narrative and you were worried about sending your CEO out there, you could legitimately give TV video clip of them talking about that crisis. That way you ensure that that's what's being quoted. We use this, we send video when they can't come to the event because there's a very famous national criminal trial going on and there's no reporters to come. That happened for a long time.
Yes.
They're busy with other stories, or it's just a holiday or special occasion. And I'll show you a few examples. I want to give Carly and everybody a chance to kind of open this up for discussion. So we're going to push the presentation out. You can click on the images and watch the video clips. I don't want to share video clips because it'll take time. And frankly, like it just looks like news segments. I'll have some screen captures, but before I do that, I want to talk about something that's the most important question that you can ask. I use this picture. It's Emily Dickinson, and she was writing to her niece, and this was in the final days of her life on Earth. And one of the final things that she wrote, this is dark, y'all. She says, I must go in, the fog is rising. And this is like the last piece of writing that we have from Emily Dickinson. My point is so eloquent, so profound at the very end. And so with that kind of dark example, I want to ask Rob, what's the most important question you can ask your subject and when?
Yeah, is there every news station, every reporter on Earth, they will always say this at the end. Is there anything I missed, or is there something you want to add?
Is that the clip?
What'd you say?
Is that usually the clip?
Yeah, that is always clip. Because honestly, they've gone through their script in their minds. You said all these things, and now it's like, oh, like, you know what? This is our message. Like, this is why we do this. And honestly, that's probably the best tip you're going to get out of the whole segment. It always is.
Is there anything else you want to add? Okay, so this is a great example, right? So this was during the pandemic. There was a lot of myths out there. Live 5 reached out to us and wanted to do a segment on like some myth busting segments. We did a bunch of them. When you watch this clip, and we were just loved that the reporter did this and said that, like, you know, when I asked Dr. Oliveria, she gave us the questions, we asked, we sent the film, and then it was totally okay that Live 5 claimed this as their own content. I mean, it was a slam dunk. This is what when we talk about like, how do we send this out? I want to show, not tell. This is kind of like what our press release looks like. Now, below the screen, there would be a few more paragraphs, but really easy. Like in the subject line, we say video, breast cancer screenings for the underinsured and uninsured, so that our TV producer partners know that they're getting some video, right? And then we just key them up. Here's a sound bite, and then we just key it up with like the keywords that they're getting. 3 sound bites, and then a little bit of B-roll. And usually the B-roll is like whatever office they're at. It's just some activity in a building.
And it's nice too for the doctor's office, like maybe they're brand new and haven't done anything. You say, hey, this is going to be great exposure. We're going to record your office. We're going to show you your location, and people are going to know what you're doing there. So in this particular case, we did B-roll of the actual event that they had before. And I recorded it, and they saw all the stuff. They saw the pink, they saw the people, they saw doctors doing their thing. It was great. They still use it, by the way.
Yeah, they all used it. See, here's an example that just everybody used it. And that's what our video looked like there with the doc. I mean, it's pretty simple stuff, right? It's just the doctor talking. You'll see on the right-hand side, that was like some of our B-roll that we provided. This one worked great. Is it pollen or is it COVID-19? Probably could have done this in the spring. It's just like so approachable. And then we have Dr. Yarian, and she's just talking. They loved it. We made this one easy. This is our behavioral doc, and she's talking about the stress of politics and spending too much time watching social media leading up to the midterm elections. Little dicey. We wanted to encourage voting, but we also wanted to like put out there, like, just tap the brakes, because this can lead to conflict in a marriage. It can lead to just like being stressed out, kind of like, you know, watch how much news you consume. A little bit of a contradiction, because we gave it to TV news. They loved it.
And to add on to that, I'm sorry.
No, go ahead.
But in the end, we also like, and if you need care, this is where you go.
Yeah, that's exactly right. We talked about Halloween, avoid these Halloween, use these Halloween tips. It's just about like how to keep it kind of somewhat healthy in this like moment of just like bathing in sugar, and they love it, right? All right, so like now at this time, I've kind of done sharing, and let's see. So I think, Harley, we can open this up for questions.
Thank you so much. Okay, I've got lots of questions, but first I want to open it up to everyone else. You can type them in the chat or just go ahead and ask away.
Push escape.
All right, I've got a question.
Go ahead.
How long has your team been doing this?
I've been doing it since I got here, honestly.
3 years?
Well, about 3 years.
3 years, yeah.
Yeah.
And we talked about this before at the CHPRMS conference, like how often do we do this? So we kind of went back, and I looked at media placements and tried to like make sense. And I think we came down to like 20% of the TV media placements, 25% were just like, the ones that we provided. So like maybe 1 in 4 times. I mean, the truth is that when you pitch the story, and they send the crew, the clips are long.
Yes, we want that. I mean, but it's such an easy way. So this month in particular, we're doing stuff on the bridge run, East Cooper Bridge Run. So we're sending out clips about once a week on, I don't know, tips, being healthy, making sure your knees are okay, making sure you have the right feet. Not right feet, right shoes. And then next week, we're going to talk about what kind of food you should be eating. Just really tangible things that are going on. But I don't expect all the news stations to come to me like, hey, you want to talk to the doctor about eating bananas and eating spaghetti the night before? Like, they don't have the people to do that. They don't have like the energy to like come all the way to, maybe this doctor is about 30 minutes away. Like, I can do that. I can knock it out and have it to them.
We've got some questions in the chat now. Sarah wants to know, how do you essentially spread the wealth amongst providers and all your locations, if, without showing favoritism and sharing the spotlight?
That's a great question.
Yeah, and I mean, sometimes it does happen. I mean, sometimes you have those people who are your go-tos. I'm sure everyone has like that primary doctor who's like, oh yeah, I love educating all this stuff. Well, now this is the opportunity that you have time to go spread the love. Before I go out and do things, I'll reach out to our liaisons like, hey, we have any new doctors are here, and usually when they first start, they're really anxious to like, get their practice name out, and this is an easy way to do it. So this is actually really, really good way to spread the love, because yes, we have a huge hospital system. We have 6,000 employees. We got to touch everybody. We have 4,000 doctors. We have 4 different hospital campuses. So yeah, this is a really good opportunity to like, reach out to those people that may feel like they're not getting love. Like, hey, we want to talk about it's St. Patrick's Day. Can we talk about, try not to overindulge and, something like that.
And I would add that we often get phone calls from physician offices or physician leaders that say so-and-so needs some love. And you can't solve it immediately, but you tuck it in the back of your brain, remember that. And it's amazing how the story will arise or an opportunity will arise for their specialty. And then you go to them. And they're kind of on the hook, right? Because they've already said they're kind of vulnerable. They want to see more patients. They're not getting a lot of traction. It's like, when I call you and it's go time, we got to come over and film this. And I want you to be ready. And so we've used that to diversify our physician pool, because we know that certain doctor needs patients. So that's another tactic that we use.
I know we have people who also use these tactics in their own offices. So if anyone wants to chime in with any additional comments, please feel free to. In the chat, Derek says that doing this is also a good way to create buy-in from those who might be skeptical. If you have a doctor who's skeptical, they see an example of their colleague doing it, works out perfectly, so now they're ready to do it. Now, Karen has a question in the chat. Can you recommend any free or cheap crash courses in videography or editing?
Yeah, this is going to be, I don't hope this doesn't sound like not really amazing, but you can Google the tips of how to use like Premiere Pro software, or you can go on YouTube. I mean, it's there, it's very easy. And if you do have Creative Cloud, they offer classes all the time. So it's free if you have Creative Cloud, but you can Google and you can YouTube almost anything to give you a basic tutorial on how to do this stuff.
And Michelle might be able to chime in. She's just such a whiz with all things visual. And I know she knows that there's some help out on the internet.
I totally agree with you guys. I'll Google all the time, if there's something in particular I need to do, like say I want to add a lower third, graphics at the bottom, and I want to do something specific with it, but I'm not sure exactly how to do it in Premiere. I can just Google that particular thing and it's going to come up. I love that a video will show up and it'll show you like there's 1 minute right in this section of the video that you should watch that is about that question. So it makes it really easy. And I saw Sarah's comment about maybe doing a workshop for our conference. So guys, maybe we could do a Premiere editing training and partner up for that, because that would be fun and easy. I remember back in the day, this is almost 20 years ago, but Bon Secours Health System was opening up their heart institute and they were doing their first open heart surgery, and they did not want the news media in there for that. So they wanted to be able to provide the news media with video footage. And that was my first time getting to see an open heart surgery, which was totally cool. But we went in there and filmed it and edited the clips that we thought were appropriate to provide the news. Because God forbid, they didn't want the news people in there should that case go south, or anything were to happen. So that was like a perfect example back in the day when we did that. But yeah, I completely agree. Google.
I have a question about like equipment. I know for me, when I shoot video, sometimes the experts, if they're wearing glasses and you can see like, because you all talked about lighting, and you can see like the light from my camera reflecting in their glasses, and I don't like that. But my camera has a light and the light helps them to be brighter. So I guess my question is, do you have any recommendations as far as how can I fix that, or how should I position the person I'm interviewing? Should I buy a different light to sit to the side? Any recommendations on that?
It's hard. So when it comes to lighting, the goal is to make everything look the same. You don't want shadows on this side. You don't want shadows on this side. So most people usually just have the one light bang right in their face. It does make it look better. I'm not saying it doesn't. But when I interview people, I make sure they're always to the right of me, to the right of the camera. So they're looking directly at you from the side. So if they do have glasses, I mean, it kind of takes the camera out of their lens, so you don't really see it as much. So that's really important to have them to the side. You don't want them like dead right in front of you, because yes, their glasses are going to be smacking that lens. But yeah, in terms of light, it's hard. It's like one of the hardest things. I just try to keep it as simple as possible. If I can interview outside, it's a nice like shadowy spot, I'll usually do it there. And the lighting in the face is good, like I said, but it's not necessary completely, because you can do stuff in post also. You can add color on your Premiere Pro. You can add, like gain if you really need to, but just try to keep this simple for yourself.
Yeah, this is going to be, that's a good thing to say, keep it simple. And this might be controversial, but there's different qualities of video that you produce. There's when you have all your leaders together and you've got this patient story that's going to make people cry, and you put so much effort into that, like money video. When you're doing, is it pollen or is it a cold or is it COVID? Like, good enough. You just get the physician up against the wall and the lighting right, and it's going to be on TV for a few seconds. We're going to put it on Facebook and Instagram. And there's like is it going to take 20 minutes or is it going to take 2 days? And so we lean a little bit towards the 20 minutes. And that's not to say that be okay with providing a bad product, but it's good enough.
And this is also important why you make your B-roll good too, because you can take time to do that. You're not doing stuff with the doctor. Now you're outside getting really good film, thinking about your lighting, and that's probably going to be on the video, on the news, more than the actual doctor's face.
I just want to echo that really quick. When we started doing more of this at First Health, there's a lot of moments where people are trying to figure out how to do it perfectly. And we all know that in most cases that will not happen. So just go do it and then keep doing it over and over again. And that doesn't mean you will necessarily get to perfect, but you'll get better. And then people will see examples of something that's good, maybe not perfect, still being good enough for what we need it for.
Thanks for that, Gary.
I'd add to, like, scope out places in your facility where, and figure out those times of days where it's quiet. There are certain times of days where a post-op is going to be empty, or the pre-op is going to be empty, and they don't mind you coming in there to film. And so it's quiet, it looks hospital-y, you know, it's got that look for you. Or, you know, there's also hallways, like back hallways behind surgical suites that a lot of times don't have a lot of traffic, but have decent light from windows that are great places to stick someone and be quiet, because you have to be careful a little bit with outside. There could be a lot of distracting noise. So I know just from working with several different hospitals, we would look for places where we knew, or even just talk to department managers and say, hey, what day of the week is this usually quiet? And then I would keep a running list of, okay, this space is quiet at this time and they're not using it and they don't mind if I come in on Wednesdays, or Tuesday afternoons post-op is empty because they don't have surgery scheduled for yada yada. So, you know, it's kind of good to keep just a running list of those places that you know are available. And when your doctor, you know your doctor's available, so you say, hey, meet me here, and you're ready to go.
Thanks, Michelle. Yeah.
We've got two good questions in the chat. Jason wants to know, can you be too overproduced as far as what you send the news?
Yes, absolutely. Thanks for asking that. Yep, they'll get tired of it. Stop
Yep.
sending us. I don't know what that balance is. We continue to talk about it.
Yeah, it's hard. Yeah, you don't want to overwhelm them, whatever. Like, so you just gotta pick and choose your battles. I mean, you just gotta feel it out. Sometimes, if I've been sending them a lot, I'll reach out to the producer, like, hey, like, if I go film this, will you really use it? And sometimes they'll be like, nope. I'm like, all right, like, this will be social, like, just keep it in the house.
And we still, that back to the point of bringing that content dry. We use it on our internal emails. We put it on Facebook. You get use out of it. But yeah, we run. It's like media placements. It's like an embarrassment of riches and then long droughts. So you're just always kind of figuring out what that rhythm is.
And as far as the editing of what you're sending to them, the B-roll is pretty basic, and the sound bites are pretty cut and dry.
Yeah, so although the sound bites, I'll usually about 20 to 30 seconds for each sound bite. And the B-roll, the main thing, if you watch any news, it's always wide, medium, tight. Oh, a little dark here. So, we might have, say this is like a Roper sign right here. We'll have like the wide shot right here, then we'll have like tight on there. It's all about going in and out. You only really need about, I count for 5 seconds for each my shot, and I count very slowly. So on this 1, 2, 3, 4, 5, and then I'll cut and just move to the next thing. So it really doesn't take you that much time to get the B-roll. Take like 20 minutes, 30 minutes to get all your stuff and make sure you're, I try to, most of us are storytellers, right? So you want to tell the story of the hospital. Like, we are at the corner of A and B, and this is what the hospital looks like when you pull up to it. Now, when you pull up to it, you're going to see this sign. You're going to see the tides. And then you're going to come to the front desk, and this is where the front desk is. And then you're going to go into the clinical room. That's kind of how I think about when I take my B-roll.
Allison has a question. She says, do you have tips for framing your expert in the shot that you get?
Yeah, here, like right here, and a little bit to the corner. So people will talk about the rule of thirds. It applies for video too. So you kind of want them in the middle, but a little bit to the side, and looking at you like it's having a conversation. So that's exactly how you want it to look. I usually do it from chest, a little bit of headroom. But yeah, for the most part, that's how I make mine look. I think it looks more like a conversation. It's comfortable. The doctors start talking about, oh, how's my shirt look? How's this looking? I'm like, I can literally only see your face. Like, we're good.
Molly, thank you so much for raising your hand. Go ahead.
Hi there. I just have a quick question. It probably pertains more to long form footage than quick B-roll and news shots. But when you edit out of Premiere, are you exporting your material directly from Premiere, or are you sending it to Media Encoder? What's the quickest way you've found to get that footage out?
So it all depends. So if you're doing a lot of stuff in Premiere and say, okay, this is a perfect example of how you can apply it. This is the first of 3 clips that I'm going to export. So if you're using Premiere, if you're exporting, you can't do any work. So if you want to use encoder, you can just put all those in and you can continue working. If you have like 1 or 2 clips, it's going to take and the clip's like 30 seconds, it's going to take like 20 seconds to export. So it's not really necessary to use the encoder. But yeah, as you mentioned, like long form stuff, and you want to continue working in Premiere, I would use the media encoder.
Thank you.
Amy has a question in the chat. Do you find that sending your pitches at any certain time of the day matters? And then also, do you shoot for like early afternoon to try to make the evening shows? She says when she's done it in the past, if they send it too late, it'll more likely end up on the morning show for the next day, which is still gets seen.
Yeah.
Sometimes in the morning it gets shown like 3 different times.
Yeah. So I prefer the morning just because there's going to be more eyes seeing your press release. If you send in the afternoon, say, if you send it out this afternoon on Friday, there's like maybe a 20% chance it's going to get played through the weekend. I mean, because you have people moving in, moving out. It's Friday. Everyone's like, oh, I'm not checking my email. Like it's 4 o'clock. Like I'm out of here. So I shoot for the morning. I think that's the best time. And if it's good, if it's past like 10 o'clock or whatever, I think that's fine too. I think like that 10 to 12 the morning time is, if not earlier.
And Rob has real good relationships with those, news desk producers. There's only 3 stations, so, and it's the same person working every day. And I hear Rob all the time, just talking to him and letting him know, hey, I got something coming your way. I think that helps.
Yeah.
Because it just doesn't get lost as easily in just the massive emails I'm sure they're getting.
Mm-hmm.
Michelle has a good point in the chat. Could you talk about media storage? So as you are collecting all of this video and all of your interviews, where do you save it?
Oh my word, y'all, we have not figured that out. Like we get our hands slapped every year by IT because we take up like 90% of the shared drive and we're trying to like move to like a cloud system and we don't know how to categorize it. And we started having discussions and it seemed like a lot of work and we already have a lot of work. And if anybody has any tips, just let us know.
Yeah.
Maybe that's another lunch and learn coffee and communications.
So
how to store your video.
Yeah, we have. So whenever I'm sending these clips, I'm automatically putting them in the Dropbox anyway, and we have a fair 5 terabit like storage in there. So I know they're going to be there, but yes, it's hard because videos are big; they take up space, and if you're using a shared drive with 6,000 people in our case, then they only have 5 terabits for everybody. They're going to tell you can't put it there. So I mean, external hard drives are awesome. I usually once a month I'll literally take all those videos I did and just throw them in there. I don't even have like the best way of doing it. Just I know they're there. I know they are not gone.
We'll have to include that topic in our workshop at the conference.
Yeah.
I can help with that.
Well, there's a whole discussion on how you categorize it too, so that you can go back and find it really easy. I mean, that's a whole rabbit hole. And still images too. Like we have so many good still images, and I'd love to be able to like have some way and learn how to store it and get to it quickly to reuse it.
Mm-hmm. Yeah, and I was talking about like I have like the Dropbox and my external, but no one else really has access to that. So what happens when people need to get that? They're going to go through me, and then I have to search for it, and I got to figure out how I can get it to them. It's complicated.
I will suggest a solution for you for that. Zenfolio.com. It's a photography website that I use to share libraries with my clients. And I've stored, an entire hospital's photography library up there. And you can easily set up categories and title them. And this makes it really easy to, you could just share a specific gallery with someone in a department and they can go look at it and say, hey, use that picture. Or you can share a headshot gallery, but you can keep everything up there. You can even store the raw files up there, which is helpful to have all of that in the cloud for you backed up. But it's a great way to create a library that's organized and easy to share with people.
Thanks, Michelle.
So I have a question for you all. You say you've been doing this for a long time, but for those who have not started doing this yet, can you explain how you got started and how you got buy-in from leadership? Because there is an initial investment in camera equipment. So how did you convince leadership to allow you to go forward with that? And then how did you get some of your first experts to get on board with doing interviews?
That's really good. No, so our internet's terrible. It's looks like it's from the 80s. And we keep being told that we're going to get a new intranet like every year. So we took matters into our own hands and we just created an internal news website using a WordPress site. And the most clicked thing were still photos. Our employees, it created so much engagement that if we went out and we just took pictures of smiling employees, we call them teammates, that was like clickbait. Photo galleries were huge. So the numbers proved that we were improving engagement just by creating this very simple, cheap kind of newsroom and turn content around really quick. And they were going to our news website on their own, not even waiting for emails to look at still images. So that was the buy-in to buy these pretty good Canon still cameras, which I think are pretty antiquated at this point. We're talking, they're 8 years old, and we're talking about going to a whole something even lighter and much more quicker and everything. But one became two because we had so many clicks and they took great video. And then once we took video with them, then it was easy to convince that we needed to buy more video equipment. And now we have lighting and we're trying to refine the whole position profile photos and take control of that because it's better than hiring outside. So we just started and the proof's in the pudding. Employees want to see themselves. Physicians want to see themselves. The photos are great. It all starts with internal comms, really. We always say every great external story starts with an internal story. So that's how it started.
All right, any last burning questions from anyone? All right, well, I'm gonna share my screen one last time. Oh, there we go. All right, so that's everything we have for today. Thank you so much for everyone's engagement and wonderful questions. I think this is a really informative session. So just once again, I remind you all that you can always become a CHPRMS member, and we've got those benefits that we talked about earlier during this session. And also, please take a look at our networking and events portion of our website. We have upcoming virtual events on there. And one that we are in the works of planning for late April is going to be a lunch and learn, which is free specifically to members. And that's going to be about Chat GPT and healthcare content. So that's going to be a really informative session. And again, check out our website and our social media for news on that event, plus our upcoming conference. All right. Thank you so much, everyone, for joining us. I hope you have a great day and happy St. Patrick's Day.